My name is Dr. Kevin Lance Jones, licensed acupuncturist and doctor of Oriental medicine. I am the academic dean of California Acupuncture College, and I'm going to speak to you today about the different courses that we will give you in the pursuit of your doctorate. So we'll go over several courses here today, and I just welcome you into the program. We'll start off with musculoskeletal problems. And in doing that, we will have an overview of the fundamentals of musculoskeletal problems, including MRIs, X-rays, exercise, and range of motion. We'll cover, following that, neck problems, including traumatic injury like whiplash and osteoarthritis and kyphosis. All of these will be covered. Low back pain is caused by overexertion in sports and traumatic injuries such as auto accidents, and we will focus on the erector spinae and the quadratus lumborum, which are usually not gone over enough, especially the quadratus lumborum. The knee has quite a grouping of ligaments, and we will need to deal with that when people come in. And then we will cover the ACL, the MCL, the LCL, and the PCL. We'll cover shoulder problems caused by trauma and sports, including the rotator cuff problems and dislocations. Elderly people have different kinds of problems sometimes, and the problems are with their hips, where they get arthritis or trauma. The rich man's disease is gouty arthritis, and we need to deal with the causes and the treatment. It's not quite as hard as you think. Radiculitis is very important because it is an impingement upon the nerves of the neck, the low back, and the shoulder. Hormones and how they affect the body. We'll start with menopause, the most obvious of hormonal imbalance, and how to treat the discomfort. Perimenopause, which women experience in that transitionary period of hormones. It's very uncomfortable for them. Andropause and erectile disorder, and what can we do about this for the men? And there are things that can be done through acupuncture and herbs, and we will talk about that. Next, menarche, the first period, menstrual cycle that is, and the issues that arise from little or no hormones in the body, which are quickly being replaced with gender hormones that cause all kinds of issues in the family. Premenstrual syndrome, which a lot of women have, and how to minimize and treat the uncomfortable problem. Sometimes you have to be very direct with them about this. Thyroid issues, including hypothyroidism and hyperthyroidism. We'll cover problems of the adrenal glands and treating them effectively, because this is a very common problem nowadays, because people are overworking, overstressed, and just burned out. We'll go on further with female and male fertility in some depth, especially with polycystic ovarian syndrome, endometriosis, and a number of ways to treat male infertility. We'll follow that with a summary and final exam. Traditional Chinese medicine thought. This is somewhat different sometimes and somewhat not between Western medicine and Chinese medicine. We'll go over the traditional Chinese medicine. We'll start with the 8 conditions: yin, yang, interior, exterior, hot and cold, deficiency and excess. 5 elements: etiology according to TCM. Zhang Fu syndromes. We'll cover diagnostic methods of TCM, such as inspection, and palpation, root, and branch. Next, we will cover Zeng and Xie Qi. Zeng Qi is the ability of body resistance against disease. Xie Qi is the pathogenic factors. Strengthening the Zeng Qi and dissipating the Xie Qi are two differing therapeutic principles. Treatment of the patient from a seasonal or personal characteristic point of view is a great method to get the patient well. We'll follow that with the summary and final exam. Lastly, we will go over practice management and running a business practice. First off, you will need the most important registrations that you must get. If you want to do medicine in the United States, you have to have these registrations. How to get into networks, including those important registrations. The best ways to get referrals from MDs, chiropractors, and physical therapists. Next, we will go over the benefits and liability in being a sole proprietor. How to make and market a new medical practice. Now, if you're going to take insurance, which we all do, you will know CPT codes and absolutely understand ICD-10 codes. And if you can't do that, you're going to have a hard road ahead. We'll talk about introduction to social media, which leads us to being a great acupuncturist blogger. I do that, and it really works. And a summary and final examination. My name is Dr. Kevin Lance Jones, Doctor of Oriental Medicine, licensed acupuncturist, and I am the Academic Dean of California Acupuncture College. Welcome to our school.